I think what's confusing is we have to determine, is that close contact someone is of concern for this disease process? Is the close contact casual? They just kind of breezed by them in a walk area, they handed them some papers, they were only with them for a brief interaction, less than 5 minutes or so? Or were they a direct contact and they had an extended period of time where they were less than 6 feet for greater than 15 minutes? And that's the challenge, is we really have to help individuals understand, when you are a contact, what does that look like? So there has been a lot of scientists working very hard this last 6 months or more within this pandemic to figure out what this disease process, how quickly it can transmit, can it go through, your simple cloth mask, how far can it go when you sneeze, when you talk, when you laugh, when you run, those kind of things have been looked at extensively. And so what they found is, even as of the early part of May, that definition is now different than it is currently. And so they have updated it, where the time frame was changed to now 15 minutes versus a previous time frame. And still, though, less than 6 feet of distance. So as they learn more, as they evolve more, it is an opportunity for us to understand what that contact looks like and how quickly it can transmit. A direct contact would be someone that has been in your office for an extended period of time. They may be working on a project with you. They may be closer than the 6 feet, working over your shoulder on a computer screen project for an extensive period of time of greater than 15 minutes. Things like those interactions. We also are looking for maybe you've not had that direct contact with that time period, but it's also, are you sharing food with that individual? Are you having lunch with them for an extended period of time? Are you having a cigarette? Are you sharing a vape with that individual? So things like that we actually have to look at to make sure it's not just that simple, clear-cut time frame. We also have to dive into what that interaction looked like. When it comes to direct contacts and those that need to be quarantined, public health is working directly with the supervisors and the chains of command. We are a very small team for the whole installation, and we cannot do it without their support. So we thank them, we encourage them, and if there's ever any concerns, they're more than welcome as a supervisor, as a chain of command, to contact us. We also have standardized our messaging to them so that when we need their help to identify direct work contacts, that we have an email that we send out to them, and we know we are able to get them exactly what they need to do for us to protect those that need to be quarantined. Things like an individual walking by them in a hall would be a very casual contact. Things like having a brief discussion at a front desk in a business, but never really, taking it further into your office or taking it further for a long period of time. Casual contacts could be somebody that you walked by in a grocery store, or walked by and even in the outside. Those very brief interactions with somebody is your more casual contact. If you're a casual contact and you can verify within your interaction that I had not had direct contact and I'm only a casual contact, then you do not need to quarantine yourself. I think it's an opportunity before you even seek medical. You need to determine what that interaction looked like and remind yourself, what kind of interaction did I have? If you have a relationship with that individual, I would encourage them that you reach out to that individual and say, hey, remember when we worked on this project together, or we had this interaction? Do you feel like I need to be, mindful of what I'm doing now? And do you think that it's an opportunity where I need to be in quarantine? When they contacted you and did your positive case contact, did you name me as somebody that needs to be quarantined? If you have that relationship, that's the best person that's going to be able to help you understand that process. If you don't, I think it's an opportunity to review that with somebody, even yourself or another individual, that you can say, help me understand my interaction with this person. I'd like you to run you through what I did. Do you think I need to go get evaluated and be seen? From that discussion, then, determine your route. And you're more than welcome to call the COVID screening line to see if that is an additional person that can help verify what type of interaction you've had. That COVID screening line is an invaluable resource for us right now. You should want to get tested when you're having symptoms of a disease process and you're thinking that you've had the symptoms related to a COVID exposure. So things like you've been named a direct contact of a positive case and you're now developed symptoms very similar to COVID-19. Anybody that's testing positive within Fort Riley, and then in our surrounding counties, we work behind the scenes tirelessly to look at who has been in direct contact with these individuals, not only close contact or work contacts, as well as household direct contacts. They name those individuals, they provide us those names, and then either through their supervisors or public health, we call those individuals and let them know that they need to be on quarantine. So we are working tirelessly behind the scenes to make sure that the right people are being quarantined. We would encourage that the ER is an opportunity for evaluation of individuals that have life-threatening concerns. And so it is an opportunity to determine, is that flu-like symptom going to lead to a life-threatening illness? And only you can really just help determine that as an individual based on what you're feeling. But again, we would encourage that you use those ER services for life-threatening concerns. And if it's an opportunity for the primary care to help assist you to restore your health, that you use that avenue to the best of your ability. And either way, those opportunities for medical evaluation, we are always asking that you call ahead to really and truly encourage stopping the spread of this disease process.